What we've been able to accomplish in Winnipeg is the development of more resources. And there are emergency beds as well as some treatment beds. Before the fall, we will have another 25 treatment beds that will be developed. So there are resources here. In the north, as we were sort of working through our plan, we identified that there are not the same depth of resources in the north, and that it's going to take us time to meet that goal. So what we have done is we have spoken with the leadership in the rural in the north and said we will work with you. I know that many of the agencies have found alternate placements for their youth that have been in hotels, but we need to build more capacity. So we're going to do that with them. The hotel reduction team will be expanded across the province and provide that with support.
So there's zero hotel use in Winnipeg after June 1st, and what happens if an agency does resort to a hotel?
Well, there certainly will be, as I said, earlier last week I said that we will not tolerate any hotel use, and we are serious about that. What we want to do is, if there is an issue, speak with the agency, find out what the issue is, and then resolve it. If it's another type of resource that's required, we need to develop it. Part of our emergency placement resource development is also resources for large sibling groups. There has been occasion where sibling groups as large as 8 children have come into care. So you can imagine trying to find a placement for 8 children all at the same time, because one of our principles is that we keep them together.
Did the public pressure, though, get so great that you had to do something?
Well, we've always said that hotels were a last resort. And we had these exceptions.
Yep.
And the exceptions were used, less sometimes, and we needed to take action, and that's what we did today.
So the public pressure got too great.
Well, you know what? No one wants children in hotels. Authorities and agencies, you heard the CEO of the Southern Authority say they don't want to place kids in hotels. We don't want kids in hotels. We know that that is not a safe place for them to be. What we want to ensure that when a child has to come into care, that we're able to provide them with the security that they need, as well as a strong foundation.